Hello again. This lecture is part of a series about biomechanics in orthodontics, and today we'll be talking about headgear. Just before we begin, a quick disclaimer. Most of the figures and text in this presentation is from this book, The Biomechanical Foundation of Clinical Orthodontics by Burston and Choi. I must emphasize that this is a very valuable read, and the lecture will only quickly summarize some of the highlights. So pick up your copy from the library or purchase a copy from Amazon, and I'd leave a link down below in the description. Some may argue that this is an old-dated topic, but this is not right. In spite of the introduction of TADs in contemporary orthodontics, the use of facebows and headgears has not died. It remains an effective treatment modality in children and adolescents, where TAD's success is questionable. The main uses are molar distalization and treatment of maxillary prognathism. The inner bow of the facebow is inserted into the molar tube, and the cervical strap or a headgear is connected to the hook of the outer bow. The red arrow is the force from the cervical strap. The force from a typical occipital headgear is anterior to the molar, in an upward and distal direction. It can be replaced, however, with an equivalent force system passing through the center of resistance of the molar by an upward and distal force and a couple rotating in a counterclockwise direction around the center of resistance, tilting the molar mesially. The combined movement of the molar is that the roots move apically and distally as the root tooth inclines changes. There are 6 different designs of headgears, and this is the first one, the typical cervical headgear for distally tipping and extruding the molar. The line of action of the force, which is the red arrow, from the neck strap is downward and backward and lies inferior to the center of resistance of the molar. The equivalent force system at the center of resistance is a downward and backward force, as you can see here. This is also accompanied by a large clockwise couple, this yellow arrow. So the molar is going to erupt and distally tip. The high moment to force ratio at the CR produces significant distal tipping, opening the bite so that it is useful in deep bite cases. The second design is a low cervical headgear. The force is placed much lower than in design 1, so that the force is parallel to the occlusal plane, so that the length between this and here is double the amount as in design 1. And this means, in spite of the force being half of the amount of force in design 1, doubling the length here means that the momentum stays the same. Because the momentum is so large relative to the force, the molar primarily tips distally around the center of resistance. Note that there is no extrusive force component relative to the occlusal plane, so this could be done when open bite is undesirable. The third design is a cervical headgear for translation. Now, if the line of action of the force, the red arrow, passes through the CR of the molar, it is possible for a cervical headgear to produce distal translation. However, the extrusive direction causes the molar to translate downward and backward. The fourth design is an occipital headgear for tipping a molar distally. When an upward and distal force, this red arrow, from the occipital headgear is applied distally to the CR. The equivalent amount of force is an upward and distal force with a clockwise moment, so that the molar moves upward and backward and tips backward. The fifth design is an occipital headgear moving the molar root distally. When the upward and backward directed force from the headgear is anterior to the center of resistance of the molar, the equivalent of this force is also a backward and upward directed force, but this time with a counterclockwise moment. This causes the molar root to move backwards and upwards. The sixth design is a headgear for molar translation along the occlusal plane. When the forces pass through the CR of the molar parallel to the occlusal plane, the molar translates along the occlusal plane with no extrusive or intrusive components. To accomplish that, you'll have one of two designs. Either by using a variable pull headgear like this one, and you would select the direction of the elastic up, down, or like this, so that it passes through the CR of the molar, or a combination type of headgear where there is an occipital and a cervical headgear, and the resultant of the forces passes through the CR of the molar. Now, headgears acting on a full arch. If the force applied by the headgear passes through the center of resistance of the maxilla, it can move the maxilla in any direction. But if it passes outside the center of resistance, it is going to cause either a clockwise rotation or a counterclockwise rotation, depending on its relation to the center of resistance. Now, the outbow length may be long, medium, or short. But if they share the same line of action like here, the resultant is going to be the same. So if you have a short arm, probably you can make it go down. A longer arm, you can make it go up. And you'll have the same line of action, which means they'll have the same result. Now, when altering the maxillary plane cant by using a cervical headgear, the cervical headgear pull is going to extrude the maxillary arch relative to the occlusal plane. However, this will be accompanied by a clockwise rotation of the maxilla. This clockwise rotation of the maxilla is going to compensate for the extrusive component of the force, so that the total effect is going to be steepening of the maxillary occlusal plane and reducing any open bite. However, when you use an occipital pull headgear, here the force is distal to the maxillary CR, and this is going to cause intrusion of the maxilla posteriorly, accompanied by the clockwise rotation. This is going to be much more effective in closing the open bite. As well as the molars are going up, the mandible is going to auto-rotate in a forward direction, which is also going to help in closing the open bite and at the same time reducing any increased overjet. So when we compare between the two, should we use a cervical headgear or an occipital headgear? In the occipital headgear, we notice there is intrusion of the molars, and we notice that there is a reduction in the facial height, and there's a forward rotation of the mandible so that it is beneficial to close the open bite as well as to reduce any increased overjet. For a symmetrical headgear, the occlusal view shows the outer bow and the inner bow. Assuming that the inner bow of the headgear connects to both molars rigidly, the two molars are considered a single rigid body, and the center of resistance of the two molars lies at the midpoint, which is this purple circle. The headgear forces then can have a resultant that passes through the center of resistance with no rotational moment, and the molars equally translate distally. However, with an asymmetrical cervical headgear, if there was a shorter arm on one side than on the other, it seems logical that because of one arm being shorter, there's more force. And since there's more force on this side, the side of the shorter arm should move more distally. But this is not right, because a cervical strap is going to move around and the forces are going to be equal again. So it doesn't make any difference regarding force. However, the resultant of the forces of the headgear is off-center and does not pass through the center of resistance of the molars. The equivalent of this is a force here and a counterclockwise moment. This counterclockwise movement is going to cause the left molar to move distally more than the right molar. So the side with the longer outer bow is going to move distally more than the side with the shorter outer bow. However, this is not only the case. The single force here is also off-center. It has a posterior component and it has a lateral component. The lateral component is going to move both molars to the right side, and this is an undesirable side effect that you have to keep watching out for. From the frontal view of an occipital headgear force system, we notice that the round wires of the inner bow allow freedom of rotation around the axis of the molars, as you can see. Any intrusive force component of the headgear would cause the buccal tipping of these molars, and as the molars intrude, the crowns move buccally and the roots move lingually. If a passive transpalatal bar was applied, which straps both molars together, then the center of resistance of the movement of these molars is going to be in the midline as this purple circle. And this is going to prevent the buccal movement of the molars. Now this is the J-hook. It is quite outdated. I used to use it quite a lot of times when I was much younger. And it is a very powerful tool in that it does not cause moments, it only causes forces. And this J-hook is going to be linked here to the arch wire directly through a hook in the interior region. And you have a variety of angles in which you can use it, and it's going to pull the interior teeth upward and backward in any desired direction. And this was extremely useful in people with increased incisal show. When a protraction headgear acts on a molar, an extension bar is usually soldered to the band of the molar, and the elastic usually applies the force to the hook, and this line passes through the center of resistance of the molar. A passive transpalatal bar can be used so that individual rotation of the molars is prevented. The line of action of the protraction headgear force is downward to pass through the center of resistance of the molar. An improper line of action of the elastic caused by the hook being too low or by miscalculating the angle of the elastic so that it does not pass through the center of resistance of the maxilla or of the molar, but being lower than that, in this case you would get a counterclockwise rotation moment. And this is going to cause the development of an open bite. Ideally, forces should be directed through the CR of the maxillary arch to prevent unwanted rotation of the arch. Also, this can lead to mesial tilting of the molars, which is going to cause loss of anchorage. That's why it is better, if feasible, to apply skeletal anchorage and apply the elastics directly to the skeletal anchorage and not to the teeth, so that you do not lose anchorage, especially in mixed dentition stage. That brings us to the end of the lecture of today, and I hope you liked it. If you found any useful information, you'll find that my YouTube channel has about 25 videos of different orthodontic topics, and I have listed them under playlists as a TAD workshop and learning for orthodontics. This is for orthodontists and postgraduate students, and orthodontics for undergraduate students. If you found it useful, I would suggest that you subscribe to the channel and hit the notification bell so that you're notified whenever a new video comes up. Like the video, share it if you like. You can contact me with my contacts anytime. And thank you for your listening.